Hello, this is Dr. Joe Garri from Mosa Plastic Surgery, and I would like to welcome you to episode number 7 of the Surgeon's Corner podcast. Our topic today will include a discussion on Botox and other neuromodulators, including the indications for their use in aesthetic medicine, and particularly how to determine the optimal dosing for each particular patient, including those patients that are coming in for the first time versus patients that have had it before but do not know their dosing used. Products such as Botox and Dysport belong to a group of medications called neuromodulators that temporarily disrupt the chemical pathway by which nerves signal muscle tissue to initiate and maintain muscle contraction. These products have a role to play in facial aesthetics in that they are useful in the treatment of rhytids, otherwise known as wrinkles, that are caused by the result of this muscle contraction. An example of these types of wrinkles are the vertical lines located between the eyes in the lower forehead, just above the nose, sometimes referred to as the 11s, or also the horizontal lines noted in the forehead with animation, which are caused by a function of the forehead muscle called the frontalis. Treatment with these medications, or neuromodulators as they are called, result either in a blunting or at times a total disappearance of these wrinkles by causing a temporary relaxation or paralysis of the muscles responsible for causing said wrinkles. On average, it usually takes about 1 week to see the optimal effects of treatment, and the improvement lasts somewhere between 4 to 6 months, after which time the treatment can be repeated on an ongoing basis every 6 months or so, as per the patient's wishes. When a patient is deemed a candidate for Botox treatment, the first question that usually comes up is how much Botox is needed to achieve the desired results. When dosing any medication, there are standard recommendations on dosing ranges that are followed for adults, let's say. In dosing for children, the recommendations are usually based on the weight of the child, as in a number of milligrams for every kilogram of total body weight, given in a certain interval by a certain route. Neuromodulators like Botox and Dysport are administered via small injections into muscle tissue and dosed in a similar way as we dosed medications for children, except that instead of the dose depending on the patient's overall body weight, the dose is dependent on the mass of the muscles or muscles being treated. Thus, larger muscles, like the frontalis in the forehead, require a larger dose than the smaller muscles like the procerus and corrugator, which are the muscles that cause the vertical wrinkles in the lower forehead, commonly referred to as the 11s. It is also important to keep in mind that the same muscles in men usually have a larger mass than in women. There is even a significant variability in muscle mass from one particular patient to another, even if they are of the same sex. Thus, dosing for neuromodulators is not as simple as using the same amount on all patients. There is a multitude of factors that need to be taken into consideration when finding the optimal dose for any particular patient. Some of these parameters include the age and sex of the patient, as well as an assessment as to the mass of the particular muscle or muscle group being treated. Another important consideration is an evaluation of the wrinkles themselves. Wrinkles are creases in the skin that are classified as either static or dynamic. Static wrinkles are those that can be seen when the patient is at rest without any muscle action whatsoever, as when the horizontal forehead lines are seen on patients with the face totally at rest. Dynamic wrinkles are noted only with movement or activation of the muscles of facial expression. On younger patients, for example, the forehead skin can appear totally smooth at rest, but the forehead lines prominently appear when the patient is asked to raise their eyebrows. Patients with static wrinkles that can be seen at rest usually require a larger dosing of neuromodulators than younger patients with dynamic wrinkles only. Botox, Dysport, and other neuromodulators are dosed in units. Figuring out how many units a particular patient needs for a certain muscle or muscle group is paramount in achieving consistent, optimal results and avoiding potential complications and added expenses associated with overdosing. It is important to note that these units by which we dose neuromodulators are not equivalent across the different medications. For example, to achieve the same amount of the effect of 1 unit of Botox, 3 units of Dysport are needed, meaning there is a 1:3 ratio in dosing equivalency between Botox and Dysport. This is not to be understood to mean that the equivalent treatment of Dysport is 3 times as expensive as that for Botox. as pricing per unit is also different between the different neuromodulators. As confusing as all this can be, the way neuromodulators are often marketed to patients can add further uncertainty to the issue. When these treatments are marketed in terms of regions by fee amounts, as for example, forehead Botox for a certain fee, rather than by dosing units, it can be very confusing for patients and injectors alike to figure out if patients are receiving the adequate dose to achieve the desired results. Moreover, achieving consistent results in subsequent treatments is made more difficult without delineating the number of units used for the particular area being treated at any given point on any given patient. Thankfully, there is a method by which appropriate dosing can be ascertained for any particular patient and for any particular neuromodulator to be used. As a first step, there are standard dosing recommendations for an average patient that can serve as the starting point in that process. For example, recommended standard dose of Botox for the forehead area to treat the frontalis muscle in the average patient is 40 units. So for the average female patient with dynamic wrinkles, this would be a good starting dose, whereas for a male patient or any patient with static wrinkles, perhaps a higher dose of around 50 or 55 units might be more appropriate. After this initial treatment dose is used, the patient is brought back in 1 week to evaluate the efficacy of the treatment rendered. Remember, the peak effect of neuromodulators is not seen until at least 5 to 7 days after treatment, so one needs to wait for at least 1 week prior to assessing results. If during this follow-up the patient is satisfied with the results of the treatment, then this dose is repeated every 6 months as per the patient's wishes. However, if less than the optimal results are achieved, it is important then to assess whether the dose given caused complete blockage of muscle action of the muscles or muscles being treated. This is checked by asking the patient to activate the facial muscles that accentuated the wrinkles, such as raising their eyebrows to accentuate the forehead wrinkles, for example. If the patient still has muscle function, this means that the initial dose that was used was insufficient. Thus, the initial dose is then augmented right then and there by adding another 10 to 20 units and reevaluating the patient again the following week. As long as the results are suboptimal and the patient still has muscle function, this process can be repeated. Once the patient returns satisfied with the treatment results, then the total dose administered can be considered the optimal dose to be repeated every 6 months on an ongoing basis. However, if the wrinkles persist after the muscle or muscles in question are completely blocked by showing no remaining muscle function, then this means that the efficacy of the neuromodulator used is maximized, and adding a higher dose will not achieve any improvement in results. In this situation, other treatment modalities should be considered, be it fillers, lasers, or surgery as indicated. Whether a patient presents for the first time or after having had prior neuromodulator treatment for facial wrinkles, finding the optimal dosing for that particular patient is paramount in achieving consistent, desired results in subsequent treatments. Armed with the proper dosing information that best works for them, patients can become better healthcare consumers and easily optimize results while reducing the potential complications and expenses due to overdosing. Following the protocol described above, this ideal dosing amount can be easily ascertained, making future neuromodulator treatments much simpler and predictable for all involved, be it the patients or the injectors. Thank you very much for your time and attention.